Welcome to another episode of Arthritis at Home. I'm Kelly Lendvoy, ACE's VP of Communications and Public Affairs. Welcome you to a special episode on artificial intelligence, AI, which is becoming part of our everyday lives in the apps we use, the websites we visit, and even in how healthcare is delivered. It's a type of technology that can analyze information, make predictions, and even carry on conversations. Arthritis Consumer Experts has launched this week a national survey on artificial intelligence and arthritis care. We're wanting to find out how familiar people with arthritis are, how comfortable they are using AI, what kind of tools or information might help them. And joining us today to talk about AI and our newest national survey is ACE's president and founder, Cheryl Koehn. Cheryl, welcome.
Hi, thank you. Great to be here as always.
Before we dive into the actual survey, Cheryl, maybe you can just generally talk and discuss for us what sort of areas where AI can address urgent challenges in arthritis currently in Canada.
Yeah, I guess that's a great place to start this conversation, Kelly. And one of the reasons we launched the survey, as you well know, I think of the urgent challenges in arthritis in a couple of sort of big buckets. The first one is delayed diagnosis.
Hmm.
Even though science has advanced and that science and the results of science has been incorporated into clinical care and standardized clinical care, to be more specific, there's still issues in terms of people being able to get a diagnosis quickly. And, it, as most of our audience who's living with arthritis knows, when you have a delay in diagnosis, it actually means you're living with the implications of arthritis longer without actually having solutions to address them, because you don't even know that you have it. You suspect, you guess, you worry, you do all these things, but you don't actually have a hard diagnosis in hand. And that's particularly true, of course, in our rural, remote, sort of northern communities. So delayed diagnosis is still a big challenge and an urgent challenge in arthritis care. I think another one is inequitable access to specialists. So I'm talking specifically about arthritis doctors. The formal name for an arthritis doctor is a rheumatologist or an arthritis health professional, such as a physiotherapist, an occupational therapist, a nurse practitioner who were specifically trained in arthritis. So these are people who help support, augment, and even lead certain aspects of the care journey for a person with arthritis. So there's inequitable access. And then there's fragmented care models. So what happens in Nova Scotia isn't necessarily what's happening in New Brunswick or happening in Alberta or happening in British Columbia. So we have fragmented care across the country, and we have fragmented care in provinces and territories. So fragmentation is a big word in our lexicon, and one that has been, I think, an age-old problem in arthritis care. There's more and more administrative burden, Kelly, if we think about the key challenges. And and it's, I mean, the reasons for this are multifactorial, but the people that are supposed to be examining us, examining our joints, taking our limbs through range of motion, actually doing a complete research-based physical exam, are busy filling out paperwork. Now, I don't necessarily mean an 8.5 by 11 piece of foolscap. I mean on a tablet, on a phone, on their computer. They're busy doing administrative work, which is not where their value lies in the healthcare system. And then finally, there's an underuse of what we call real world data. So historically, as science has taught the clinical care model in arthritis, how best to do things, how to get the best outcomes in patients, we look historically at data and we say, oh, well, this worked or this didn't work or this kind of worked, and here's what you change to make it work better in terms of a process or a therapy, whatever. So using administrative or real world data is a very important step to getting at what we call personalized care. Personalized care is not does not come from a test tube in arthritis because we don't have those kinds of definitive tests that you have in diabetes and heart and stroke and cancer. It remains the physical examination and the taking of a history, health history, paired with, some data that really does help get at a personalized prescription. And I don't just mean for medicine, I mean for all aspects of care. So it's those big five, Kelly, that I think are the remain hurdles. They're not as big as they were, but they still exist. They're still in front of patients. They're still in front of clinicians and even healthcare policymakers.
One of the one of the events and collection of evidence that helped inform our national survey was ACE's attendance at the 2025 Canadian Rheumatology Annual Scientific Meeting, Cheryl. And there we heard numerous presentations on how AI technologies are meeting or have the potential to meet some of these challenges that you've outlined. Can you briefly tell us how AI is changing arthritis care?
Yeah, certainly. And I wanted, my caveat is it's it is in the early stages. I think most at the clinical or the research end of things would suggest to you that that's the case. It's early days. The Canadian Rheumatology Association and the Ontario Rheumatology Associations, Kelly, they both have AI sort of projects ongoing right now. So we're really hoping to feed in the results of our survey to those organizations and beyond to help them consider, the patient viewpoint. I think that's what Arthritis Consumer Experts has for the past 25 years been about. It's been about bringing the views of people like me, I live with rheumatoid arthritis, to the very people who are trying to create new types of care or build AI platforms, work on machine learning so that it actually delivers good, not harm. So at the Canadian Rheumatology and Arthritis Health Professions Association meeting, they looked at how artificial intelligence can actually detect early signs of inflammatory arthritis through imaging analysis, through symptom patterns, lab data, looking at the time of which a referral gets written and the time it gets picked up to reduce diagnostic delays. So that's just one kind of area, Kelly, and it's really focused on inflammatory arthritis, which when it moves rapidly, destroys joints rapidly or can destroy joints rapidly. So it's a super important area to be looking at. There are artificial intelligence models, or AI, as I'll maybe call it from here on in, that are being developed to help predict flares, joint damage, treatment response, helping clinicians and patients make decisions to change therapy or start a new therapy or tweak a therapy sort of cocktail earlier. So before you go down that slope of a flare. And for people who are watching this episode and hearing this, they know as well as I do how important that is to me as a patient living with an inflammatory arthritis. If there was a way using AI to predict this, man, oh man, I'm sort of tired of the phrase game changer, but that's a game changer for someone like me. Smart apps were talked about. So these are, mobile applications, wearable devices like a watch, or an armband. There are various different types of wearable devices that are powered by AI. They track pain, your sleep, your ability to be mobile, medication adherence, all of these things in real time. And that supports people between clinical visits. Those are all driven by AI. There's sort of virtual triage models on digital platforms. AI has the potential to bring sort of high quality care using those types of platforms to rural, remote areas and also marginalized communities. I mean, communities that are indigenous, Black, other racialized communities, people who are in those communities who are women, who are the most underserved in our arthritis care system and all types of chronic disease care systems. So if these could be designed and deployed ethically, and with the viewpoint of patients included in the design of them as the machines learn from the things that are being input into them, we stand a chance at addressing some of those challenges that I mentioned earlier.
Yeah, I think something just to underline for the audience is to understand the distinction about AI-driven technology and just simple tracking technology that we have right now on our phones or on our watches. And that's the difference is that AI-driven means is when the data is not just collected, but interpreted, analyzed, and acted on, such as
Yeah,
the examples that you gave.
yeah, that's a great point, Kelly, and it reminds me to let our community know, people watching, that you know it, data is a big part of this, right? And historically, data is biased. This data is collected in healthcare systems that are known to be racist, just calling it for what it is. And so, you don't want AI, artificial intelligence, and machine learning to be learning from data sets that are already biased, right? Because all you do then is import the bias that exists in our non-AI driven healthcare world into an AI driven healthcare world. And that is not what we want. It means that AI would be learning from biased decisions. Again, not what we want. And when we talk about this, traditionally in healthcare, algorithms, systems, guidelines have been written by white males. They are colonial structures. So this can't be the way we move AI forward. And it's really one of the key reasons we're running this survey is to be able to hear from our Indigenous brothers and sisters in arthritis, folks in our community who are Black, other racialized communities, rural, remote, women in those communities I've just mentioned. That's going to be a super, super important aspect of trying to eliminate bias into the development of AI in arthritis care. So thanks for letting me get on my little soapbox there. And there are ways to mitigate that, Kelly. And those are the things I think, testing AI, making sure that before it's implemented, it's tested to see if it's biased, regulation, legislation, collaborating with patients like us in development. These are all the things we can do to address what I just spoke about, the bias and kind of doing a reality check of where we're at in implementation.
That's a nice segue to the next question and focus of the rest of our time together, and that is to look more closely at the survey and what
Yeah.
we're trying to achieve with it. You talked about bias, you've talked about ethical application, um, the trust and privacy issues that people may have. Tell us a little bit more about this survey that has just been released this week and what our objectives are with it.
Sure. So Really high level, Kelly. Arthritis consumer experts launched this survey, as we have many of our other national surveys, to learn from and understand what people living with arthritis and their caregivers think about AI. So, really broadly speaking. So, by taking the survey and looking at the results of the survey, we aim to learn about the levels of awareness of AI, Kel, people's familiarity with it in our community, how comfortable they are if they do know about AI, how comfortable they are using AI-driven tools. Look at their concerns and related specifically to trust, privacy, the bias that I spoke about, and also to identify opportunities to increase equitable access in integration of AI-powered solutions. So trying to address some of the things that I just talked about, which are potential harms or pitfalls, if you will, of AI, trying to get at the good of AI, and always learning from our grassroots. I think that is the strength of our community. The survey will serve really the results that we pull together will serve as a baseline sort of needs assessment for patient education and professional development in the digital sort of era. So it's going to help us develop a course, a joint health education course on artificial intelligence. So, it's basically an AI 101, to be really jargony. I think that's going to be a very cool outcome of this survey. So the people that take it are actually helping us develop. They're working in collaboration with us to develop an educational offering. So the survey doesn't take long. It's about 10 minutes. And it's completely anonymous. We cannot de-anonymize the data. It's collected through SurveyMonkey. And we have lots of opportunities with open-ended questions, Kelly, for people to free form a right within the survey. So it's not just, pick ABC or pick out of this list of items. You actually get to tell us in a more, specific or granular way what you're thinking about the topic. So we always find those are one of the most enjoyable aspects of our surveys, is that people really get to go beyond just the simple ticking of boxes in our surveys. So super excited. 10 minutes of your time. The impact can be huge. So we appreciate everyone that is thinking about or who will go on to participate in the survey.
And we can't emphasize enough how much we appreciate people participating in our national survey programs, and to let all of you know that the findings and results from these surveys inform not just the information and education programming that you see on our website, for example, but it also motivates us and informs the work that we're doing when we meet with government, when we meet with arthritis healthcare professionals. We share these results and work together with those different stakeholders in terms of making sure the arthritis patient voice is heard loud and clearly on a really, really important issue. Cheryl, it reminds me, it was just approximately 4 years ago where we were publishing results on a national survey about equitable access to virtual healthcare. Times are changing so fast. That was a really important survey. We've done a lot of work on virtual care. We're sort of at the same start of a journey right now with AI. And once again, really encourage everybody to participate in the survey and help us guide our education and programming in a really important area.
Yeah.
Well, that wraps up another episode of Arthritis at Home. And once again, we'll have a link at the end of this to the survey that you can complete, and also an opportunity for you to ask any questions on this topic. And it's certainly something that we'll be covering and watching closely moving forward. So thank you, Cheryl, for your time today.
It's my pleasure. And to everyone out there, hope you have a great day.
Thanks, everyone. Look forward to seeing you again on another episode of Arthritis at Home.